hard to argue that any group has taken the brunt of the pandemic like our frontline healthcare workers in hospitals.
Now, that's especially true for those in the COVID unit at University Hospital in Madison. CBS 58's Victor Jacobo spent time there and has their stories tonight.
Bursting at the seams, that is how one of the leaders of UW Health describes the status of University Hospital here in Madison. I spoke with staff here who plead with the public to do their part to slow the spread of coronavirus, to prevent needless pain and suffering.
It's one giant ball of anxiety trying to figure out where the next patient's going to go.
Respiratory therapist Donovan Betcher just finished a 12-hour overnight shift at one of University Hospital's COVID units. When he leaves and sees people at restaurants, bars, or large gatherings, Betcher says he is disheartened.
It's a slap in the face, to be honest. You look on social media, there's a lot of talk about healthcare heroes and all that. Well, if you really want to respect people in healthcare or anyone that has to work right now, stay home, wear a mask.
We're, breaking the record for a number of patients every day.
Doctors say the current surge in cases and hospitalizations is pushing the hospital in a dangerous direction.
Because of the stress and the large numbers of patients, that it's possible we might have to triage, like battlefield triage, and that resources will be limited.
One resource that is stretched thin is the hospital's nurses.
It is difficult. Nurses are the first person that our patients see, and nurses are the last person that they will see in their last breath.
Mavic Jardis is an overnight charge nurse and has been at University Hospital for 18 years. She says she is proud of the nurses she oversees, but they too are reaching their limits. She hopes the community will do their part to slow the spread of the virus.
Overtimes, extended shift, long days, long hours, not seeing our family, just to be here and take care of the sick. So I'm asking it just to give us a little break too.
It's exhausting both physically and emotionally to keep doing this day after day for months on end.
UW Health's chief quality officer is concerned about what the winter holds for the pandemic. He says there is anguish among hospital staff because they know if the public steps up, they can prevent a bad situation from becoming catastrophic.
We know that simple behavioral changes could change the trajectory of this. When we go through the units and we see the people that probably aren't going to make it, we know it didn't have to be that way.
Jeff Ponoff told me it's also good news that there's vaccine distribution on the horizon, but he does not want people to think that we're at the 2-minute warning of the fourth quarter at the end of a football game. Rather, we are still in the middle of the third quarter and have to keep fighting the spread of the virus. Reporting outside University Hospital in Madison, Victor Jacobo, CBS 58 News.